Hi everyone, this is Dr. A from Hope Fertility. I'm going to talk about part 2 of what we do in the IVF lab. So if you recall, part 1, we talked about how we get eggs, and now I'm going to tell you what we do with those eggs. So this is like a behind the scenes look, very exciting. So just starting off where we left off, this is an egg, this is the supporting cells of the egg. So first thing is we have to fertilize the egg, and there are various ways. What I'm going to show you here is something called ICSI, ICSI. So my embryologist takes a sperm and injects it right into an egg. You see that right there? That's the sperm going directly into the egg. Next, after the egg is fertilized, we look for signs of fertilization, which is that. Then the eggs are put into an incubator, and we tend to leave our embryos alone at Hope Fertility. We just want it to grow on its own under the right conditions, the right temperature, the right humidity, the right gases. All of those are very, very important. Next is we look at the embryos, and sometimes we look at them on day 3. So here's an example of a day 3 embryo. That's what we call cleavage stage cells, also known as day 3 embryos. Those sometimes could be transferred, but most times we like day 5 or day 6 or day 7 embryos, what we call blastocysts. So these are examples of blastocysts. Do you know we can test these embryos? We can test them to make sure they're genetically normal. Here is a video of my embryologist taking a sample of the embryo. And we would know if this embryo, before we transfer it, if it's genetically normal or abnormal. We can even tell if it's a boy or a girl. After we get those results back, we can do a transfer, an embryo transfer. And here you can see my embryologist setting it up. The embryo is loaded into a catheter. And here my lovely patient who consented to this video is undergoing an embryo transfer. Transfer is placed into her uterus, it's injected, and a few days later, more or less 10 to 14 days depending on the stage of the embryo, we know if it works or not. Thank you so much for watching. I hope you found this informative. Take care. Bye.